Just a quick note, the following video is quite long and lengthy, and many of you will probably not give a fuck or two shits about this video, but it is informative and meant as educational for those who might be going through a liver issue, liver disease, liver transplant upcoming, family members, etc., etc., etc. So watch if you want to, don't if you don't. Good morning, and welcome to Liver Talk with Steven. On today's video, we're going to be refilling our massive monstrosity of a pill organizer. Let's begin. First, we must begin with our supplies. We have our massive monstrosity of a pill organizer. We have our bag of pharmaceutical friends. And we have our 347-page post-liver transplant guide, complete with tabs. And inside of our guide, pills, and it tells us the description of the pill, what it does, when we're going to stop taking the pill, the color and shape of the pill, ascended or descended by the time in which you take those pills. And as you can see, there are multiple pages. So we're going to use this as a guide to fill our massive monstrosity of a pill organizer. Okay, in case you're wondering what I was doing, I was just opening up all of the little tabs and putting it in here. And you're probably wondering, why are there pills in here? So there are pills in here already because I don't have to take pills at noon anymore. So I use those as my overflow lockers, and I'll explain. So I get tested, I have blood tests multiple times a week, or now I'm down to 2 days a week. But every time that I take a blood test, they tend to change something about the volume of pills that I take. So for example, they may change my anti-rejection pill from 10 a day to 8 a day or something like that. And so when that happens, what I'll do, rather than dig out the pill bottles and put the individual pills back into the pill bottles, only for them to increase my dosage to the next lab result, and then me have to pull the pills back out and whatever, I use the noon little lockers as overflow. So I'll take away pills and put them in there for future use, or sometimes they change my diuretics from 3 a day to 2 a day to 1 a day to 3 a day. So I just keep all of those, mostly anti-rejection, diuretic, and my steroid pills, because those are the ones that they typically change. And so I always have an overflow of those in case I need to add or take away, and that way I don't have to get the bottles back out. So that's why there are pills in the noon lockers. So next up, we're just going to start going through this list and put the pills into the individual lockers for the times of day on the days of the week that I need to take them. Let's begin. Okay, so you may not have noticed because the video is going so fast, but there were 5 different times that I went like this and pointed this way. And that is because as I do this every week, anytime I'm down to about 2 weeks left of pills, I put them to the side and then call the liver transplant pharmacy and let them know which bottles or which prescriptions I need filled. And then they ship them to me within a few days. And so that way I never run out. I will go through the pills that I'm taking. Obviously, it's going to vary by patient. I'm not a doctor. Please seek medical advice for more information from your certified professional. I'm just going to go over what, and I'm not even sure if this is allowed on social media platforms. It's not. I'm sure that they'll strike me and take it down or whatever. But I'm just doing this for educational purposes, really. Honey, you're going to learn today. But I think it's helpful. So these are the pills that I am on, and also how long I'm going to be taking it. So just to give you some context, 42. So I'm on Tacro, which is a green capsule, a very small green capsule. I take 4 in the morning and 4 in the evening, 1 milligrams. So I'm taking a total of 8 milligrams. And actually, I take that back. They up my dose. I'm doing 5 and 5, so I'm taking a total of 10 milligrams. And that is to prevent liver rejection. I'm also taking myciphenolate, also known as Socept. It also is a rejection pill. I take 500 milligrams oral tablets. So I take 1,000 milligrams in the morning and 1,000 milligrams in the evening. I take prednisone, which prevents rejection as well by lowering your immune system, which is why you're so immunocompromised. I'm down to 7. So typically they told me that liver transplant patients start on 20 milligrams per day, all 20 milligrams in the morning. I went through some liver rejection, a small period of liver rejections. They doubled my dose. So I was up to 40 milligrams. They just reduced it to 35. So I'm taking 7 pills a day in the morning. And that will go on for 3 months. Actually, so the Tacro goes on for the rest of your life. The myciphenolate whatever. The second rejection pill goes on for 3 months. The steroids go on for 3 months. The next one is Valsite. It is to prevent viral infections, including CMV. I take 450 milligrams in the morning, 450 milligrams in the evening. The last one is Nystatin, which, I totally forgot about this. I have not been taking it. It is a mouth swish and swallow. So you take a very small amount and you swish it around your mouth and you swallow it, and it prevents thrush. I looked it up at some point. I don't remember what it is, but it's something that can give you like bumps and sores in your mouth from all these different pills that you take. And I definitely don't want that because I heard it's very painful. So I need to get out my bottle, bust it out, and start doing that because I've forgotten. You're supposed to do it before every meal, or after every meal. Switch as well 5 milliliters 4 times a day after meals and before bed. The next one is Bactrim, and I'm giving you the brand name, and I'm taking generic if it's available. It prevents PCP, PJB, pneumonia. I'll be on it for 6 months. I take 1 tablet of 400 milligrams per day in the morning. Baby aspirin, 81 milligrams. I take once in the morning. It prevents blood clots. Procardia XL is for high blood pressure. I take 1 tablet a day. Now, before I started taking all these pills, my blood pressure was just fine. It was in the optimal range. Well, when I was drinking, it was high. But I stopped drinking last year, and shortly, probably within a month after I stopped drinking, my blood pressure was normalized. But now that I've started taking all these pills, my blood pressure is normally higher. But with that pill, it's right in range. The next one is Meprazole, which is a acid reflux pill. I take 40 milligrams a day, which is high. Before the liver transplant, I only took 20 milligrams a day, but the 20 milligrams was no longer working for me. Actually, I didn't even take it that often. I took like 40 milligrams every 3 days, so however that averages out. Before transplant. After transplant, that no longer worked for me. They did not want me taking this pill. They said it does have long-term side effects. I've been taking it for a long time. It's the one pill I feel like if I had to come out and whore myself for $100, if it cost me $100 a pill, I would figure out a way to pay it because I like die without it. Like, just horrible. It doesn't even matter if I don't eat anything acidic or tomato sauce or pizza sauce or whatever else is acidic. I just could not sleep. It just hurts so much pain without that pill. They wanted me to take there's several different versions of acid reflux pills and heartburn pills. The other ones just do not work for me, point blank. I've tried all of them. They don't work. So I'm still taking the Meprazole. The next one is a multivitamin. I take it once a day. The next one is calcium carbonate, which helps keep bones healthy. I'm supposed to take it twice a day, once in the morning, once in the evening, 600 milligrams. The next one is vitamin D2. I only take that once a week on Saturdays. It's 50,000 units, and it treats vitamin D deficiency. The next one is Bumex, which is the diuretic. I go up and down with that. I took a lot of it before the transplant because I was constantly swelling up and retaining fluid. And, that went away right after the transplant, but it slowly crept back up, and they said it will go away eventually, but still retaining fluid. Right now, I'm not taking any at all unless I gain 5 pounds within a week, and I've actually already gained 5 pounds. I gained 10 pounds over the weekend because I stopped taking it like Thursday, I think, or Wednesday. I did gain 10 pounds even though I was very active this weekend. So I need to start taking it again, but they told me not to take it again until I talk to them first, so I'm going to call them after I get done shooting this video because I feel like I need to start taking it again, as long as my kidney's okay, which I probably won't know that until tomorrow because my labs are tomorrow. Acetaminophen, that is obviously just like Tylenol. Take it as needed. Methocarbamol, which is Robaxin, that is a muscle relaxer. I had that in my Noon cubby hole because I may or may not need it. Actually, I'm looking in there, and I had one in there for every day for Noon from last week, so I never took any except for one. I took one day. So I just put one pill in that one day that I took last week, and I just keep that in there just in case I need it. Same thing with acetaminophen. I have that in my that little Noon cubby hole as well because I need it. Again, it's so that I don't have to go dig for pill bottles. The next one is a stimulant laxative. I have that in a bottle just sitting over somewhere else in case I need it. I have not needed that in a month, probably. My poop schedule is right on schedule, honey. The next two, I forgot about the next one is lidocaine patches. I haven't used those since I got out of the hospital, but I do have some if I need them, but I don't. They're like a pain reliever that you physically put on your skin. And the last one is trazodone, which I think was created for depression, but they use it for insomnia. And again, I've had this prescription for quite some time. I rarely ever took it. Post-transplant, I have been taking it every night because it's just hard to sleep on your side. I'm getting better at it and getting more used to it. I'm sleeping more soundly now because I'm not in as much pain and it's not as uncomfortable. But definitely, and I may lay off the trazodone at this point. Actually, I'm gonna try that this week. Because if I don't want to be taking all these pills, and believe me, the people that I tell that I take all these pills to, they're like, oh my God, it's going all in your liver. I get it. I'm like totally pro not taking pills. But I will say, Vanderbilt has saved my life. And so I'm trusting what they're telling me because they've been very good to me. And, you know, I don't like taking pills. I do believe in alternative medicine. But I'm just not fucking around with this. You know what I'm saying? Like, everything is going smoothly. I feel good. I'm looking good. I'm feeling better. I'm getting better. I'm healing nicely. Everything is just like on the up and up, and I'm not trying to fuck with that. So, you know, it is what it is. I'm going to follow this to a T. So, I know there's other options out there. I'm just not fucking with that. I ain't fucking with it. So anyway, I know this video was long. I hope it was helpful, especially for those of you who might be going through this, like I said, or have a relative that is. If you have any questions, always feel free to reach out. I'm happy to tell you about my personal experience. I can't really answer for you specifically, but I can kind of tell you, and I can also kind of guide you into who you should talk to, because God knows I've been through it. I've been trying to figure all this out to get diagnosed with liver disease in the first place and to get the liver transplant, to go through all this stuff. I've made a lot of contacts, so I can probably help you in some way. Anyway, I love you guys. Thanks for watching, and I'll see you next time.